Welcome back. We're talking about refractive errors and other conditions associated with them. Time now for you to call in. The number to call is 0808-054-2233. That's 0808-054-2233. And if your tweets come in time, they may be aired. We were talking about amblyopia. Okay. Could you quickly explain what that is?
Now, like I was saying, amblyopia, I'm trying to explain the process instead of just going into big definitions. Now, you have, each eye is supposed to be able to supply messages to the brain equally.
Okay.
Okay, because your eye is just a collector. It receives information. Your brain does the interpretation. Now, there's a lot of pathways in the process. You talk about the cornea, you talk about the lens, you talk about the retina, then you talk about the process of the visual pathway itself. Okay. Now, when images come from the outside world into the brain, there are some times where you, because there are different types. Okay, now let me just quickly dive into different types of amblyopia. Probably that will help me buttress my point about amblyopia. You have refractive amblyopia, you have deprivative amblyopia. Okay, now in refractive amblyopia, you have a case where, like I said, antimetropia, but now maybe an uncorrected refractive error now. So what happens?
One eye may be farsighted,
one eye may be nearsighted, or one eye may be emmetropic, that one eye may be perfect,
normal,
and the other eye may be maybe myopic or hyperopic. Okay. Now, what happens is the brain tends to ignore messages from the weaker eye and focus on the stronger eye.
And what's the result at the end of the day?
Amblyopia in the weaker eye. Because
can you see amblyopia?
You can't see amblyopia. It can only be done in the ambit of, you can only measure it in the ambit of.
So what are the symptoms?
The symptoms are, one, in some cases where you could have it alongside strabismus, because sometimes one of the offshoots of amblyopia is strabismus, like the picture you showed now.
The strabismus, okay, that picture.
Yes.
Is that the half-past for?
Yes, what you call
lazy eye.
Lazy eye, because that's for the amblyopia.
That's to bring you home.
Yes, so the technical name, or what you call, when you try to break it down, the other name for amblyopia is the eyes are lazy vision or lazy eyes.
So the brain is ignoring the weaker eye.
Yes, because it's trying to, because what's happening is this eye is giving me 90% of vision, the other eye is giving me 20%, and I need 90-90 to be able to see things clearly, or 100%. Why I'm using 90? Because you don't always get 100%. So even if the eye were getting 20-20, both images will be seen clearly.
Okay.
In terms of, with regards what the person can see, depending on what the refractive error or refractive status is. Now, when it comes to amblyopia now, by the time first of all, the doctor wants to identify why. Usually amblyopia...
You haven't told us what is the symptom. What brings the person to the clinic?
What brings the person to the clinic? Things like diplopia, double vision.
They see things twice.
Yes, double vision. Yes, double vision, blurry vision.
Okay.
Blurry vision. Sometimes other causes.
Let's take this call. Hello. Hello, Ralph.
Hello. Yes,
thank
you so much for your very objective program. You've been serving souls without even knowing it. Thank you so much. You're quite a wonderful woman.
Thank you.
And your station. Well, I would like to know a little more because of a friend who talked about this stigmatization. It's like I missed it last week.
Astigmatism.
What astigmatism? Okay, what he said today is frightening. That because I'm above 40, going to 50. You come up, I mean, it's like you can read newspapers even from the internet, and you're like, what is going on? You know, but like you said, you put it up there, it's there, and you go to the doctor and he says, get the glasses. And believe me, I don't like it. I don't like wearing glasses. I struggle with it, and it's like, I want to read this. You pull up the internet, you pull up the tablet, you can see. Is he saying it as you grow older to keep generating? Are we going blind? Man, they are frightening us.
Okay, Ralph, we'll let him answer that question. Okay. Are they going blind?
No, they are not going blind, like I said. I said presbyopia mostly affects the ability for you to read objects at close range. Okay.
Not that the eyes are spoiling.
Not that the eyes are spoiling. But the truth is, it's a reality of life. Now, people now ask this question, but I have a grandfather in the village.
Yes, they always do that.
Or I have a father in the village, he's above 80, and he can read without glasses. Normally they don't say they can read, they say they can watch TV without glasses, they can do things. And I ask, how literate is your grandpa? How literate is your pa? Because the truth is, it's a civilization-based discovery. Okay. So our need to read tiny print, our need to always use the internet, and I ask them sometimes, Does grandpa use iPads? Does grandpa use the internet? Because the truth is, like I said, it's a civilization-based discovery. So it will normally, it's just quickly, I'll just do a shift just to buttress my point.
Grandpa may have it, but he's not noticing
Yes.
because he's not engaging in the activities
that will make him discover, or he may not be literate.
Okay.
Someone who can read
Will definitely not notice.
He can know, because we're talking about near work now. So for somebody who is an illiterate, you talk about people that thread the needle, like tailors.
Okay.
Now for those kind of people,
that would pose a problem.
Electricians who have to, look for tiny things within their box, in the circuit box, what they call them, electrical, electronic engineers. Now for those kind of people, even if they are illiterate, they will need that kind of help, because they need to deal with tiny objects, tiny prints, things that, at that age, looking at it, you need to move backwards, and they tell you, I could walk at any time of the day, but now when it's getting to night time, I lose interest.
Let's answer Ahmad. Hello, Ahmad. I think we lost Ahmad, but you could try again. So we were talking about amblyopia.
Okay.
Blurred vision, and what were the other symptoms?
I said diplopia.
Seeing
Double vision
double
is different from blurred vision.
Okay.
Okay. Now, the person could also come in for a routine test.
Do they have low vision?
Yes,
As
there's
in not
low vision.
seeing well
no,
at
no, no,
all?
that's different.
Okay, that's
Now,
a different thing altogether.
Let me try and break it down. Low vision, I would interpret it as you seeing your normal light in low current. The low vision patient sees the sunlight.
So that's a different kettle of fish. It's not even amblyopia.
That's a different, no.
What do you do with the amblyopia? How is it corrected?
Okay, now you need to work with doctors who are trained in managing amblyopia or strabismic patients, because it's a very technical, it's not just the routine, go to the doctor, he checks you and gives you glasses. It's what we call a vision therapy session that is associated with managing
The person has to
strabismus.
be taught to see again?
Something like that. You are retraining the brain to accept images from the eye that it has ignored.
Does it
all
have
this
anything
while.
to do with when I see people with one covered eye?
Sorry, I didn't get your
Like,
question.
they have like a patch on their eye.
Now that's a form of training. You have the atropine therapy, which is a drug-related therapy, and there are some new drugs too that are in the business now of helping to retrain the eye. You have using your cynotophore, it's a machine in the clinic. Now many clinics don't have this, you understand, because most times people who need your treatment, sometimes they can't afford it.
Okay, because we don't have so much time. Can you make a strabismic patient to see normally again?
Usually what I would say, yes, but the earlier, the better. The earlier it is detected, the better the chance of the person having straight eyes, even in amblyopia too. The better the chance of that patient, being able to see.
Let's take this call from Charles. Sorry to interrupt you there. Charles, this will be our last call. Hello.
Hello. Good afternoon.
Good afternoon. Could we have your comment?
Yeah, first of all, I want to thank you for such a wonderful program. It's been
You're most welcome.
something that, my question is actually there is something I've actually been observing.
Okay.
Yeah, something I've been observing on the right part of my eye.
Okay.
Like the doctor there was actually explaining, having one part of your eye, having a partial vision, like impairment in one part of my eye.
Okay.
I have these, when I went for a checkup and they said I have an injury inside my eye, the doctor afterwards, he gave me a prescription, the vision aid, that I should use it for some time. I think it's the 30 cups, for 30 days that I will notice some improvement in my eye, but I've tried, I've not noticed anything. So I just want him to throw more light on it and let me know what they can do.
You have an idea of-
Yes. The issue now, he said the doctor said he has an injury in his eye. First of all, I don't know what location. It could be the vitreous, it could be the iris, it could be the retina. Now, usually those are emergencies. They are medical emergencies. If it is a vitreous injury or blood in the vitreous, it could need surgery. He could need intravitreal injections. Okay? So at that time, I will normally advise sometimes you may need to want to get multiple opinions to be sure, because when it comes to technical issues like this or very severe cases like this, what I want to be sure about my patient is make sure you make the necessary research on who you're going to meet. Don't just open your eyes for every
So
person
you have to make sure this is a qualified
you want to be sure that
optometrist or
yes,
ophthalmologist.
optometrists, ophthalmologists, even people that have to do with neurology, people in neurological department, especially if the problem deals with neurological symptoms, okay? So for this person, like I said, I'm not sure which structure in the eye is affected. Now, it could be a combination, okay? Like we normally say, it could be a combination where you need glasses and you now need drugs. But please, make your research on that.
We have to go now. Thank you so much. Charles, I think we've got the message. You need to see someone else. Get another opinion and find out what is wrong. Okay. Thank you so much for coming to the program.
Thank you.
We would have let you go on, but there's no more time. Thanks, Charles. Thanks, Val, for calling. And have a great day. I am Mary Alale Yusuf.
Thank you.